Another major element in every public awareness campaign is what's called a roadshow. Local singers entertain the audience, while actors demonstrate the proper use of ITNs and run competitions with nets as prizes. This roadshow in urban Lagos is being run by Harvest Fields, a commercial partner in Nigeria.
As you have seen today, that anytime we go on a roadshow like that, we attract crowd.
CEO of Harvest Fields, Martins Awofisayo, has seen a dramatic turnaround in public awareness of malaria and the effectiveness of ITNs.
The awareness NetMark has done on radio, on television, has made people to know there is a net that can prevent malaria, and that is what we are having here.
In less than 5 years, Harvest Fields has gone from a small distribution company to the largest distributor of ITNs in Nigeria.
Nigerians are not other poor. People can afford to buy net, and you have seen it today. What we brought here, we sold out, so the market has tremendously increased. And without NetMark, I don't think I will be talking to you today.
NetMark partners also carried out public awareness campaigns in boarding schools, the most common form of education in many African countries.
We used to have 1,000 cases of malaria per term, but nowadays, because of the use of copper nets, now we are having 68, 50. It is real coming down, the numbers.
Here, at the Mugwanya School in Kampala, the infirmary, which used to be filled with boys suffering from malaria, is empty, and the classrooms are full. NetMark believes in getting ITNs to those who need them by the best means possible, whether it be by developing the commercial market for nets or better targeting the distribution of free nets.
In my language, there's a saying, this is Onokon Waja, which in translation means there are more than one entrance or exit to a market. We've been able to evolve. We tackle it from all angles. We make nets commercially available to all people who can afford them. We work also to ensure that people who are slightly at disadvantage financially can afford and acquire those nets at a subsidized price. And then we make nets available free for those who are the poorest of the poor, who even basic feeding on a daily basis is a challenge.
When a retail market for ITNs exists, public health authorities and donors can more accurately and efficiently target those who cannot afford to pay commercial prices. USAID has sponsored this free ITN distribution in rural Nigeria.
We intend to distribute no less than 30 to 40,000 nets. The frenzy here is that so much awareness has been created about ITNs, net use, and the benefits. Sometimes it's a bit difficult to get to the hinterland, to get to the poorest of the poor in society that really need this intervention. But that's where NetMark is different. We go where others do not.
Bridging the gulf between free and fully commercial ITNs is NetMark's discount voucher program.
We work with donors, corporate social organizations by providing funding, to engage in targeted subsidy voucher schemes, for instance, in which pregnant women and children under 5 can actually avail themselves of a net at a subsidized price.
The subsidies have been funded by USAID, UNICEF, ExxonMobil, the Global Fund, and National Ministries of Health. The subsidy voucher program allows low-income consumers to buy the net of their choice and preserves the dignity of those who could not normally afford to buy their ITN.
For the people who cannot afford to pay outrightly for this net, we have seen that it has brought a lot of progress in terms of sales and in terms of distribution of the nets. So I would say that this was a brilliant idea.
Palunet was a tiny net distributor in Senegal before it became a NetMark partner. From distributing 2,500 nets a year in 2003, Palunet now distributes tens of thousands through the voucher system.
If I made an addition of all the nets we've sold since 2003, we are around 500,000 nets sold in this in a voucher program, in a retail market, and in nets sell to NGOs and something like this.
It's not only pregnant women, children, and commercial partners like Palunet who benefit from this voucher system. In Ghana, it has given rise to a type of micro-entrepreneur, the umbrella lady.
Because the vouchers help them to buy more. Since the voucher takes off 60% of the price, so it helps them to buy more.
Working outside the health clinics where the discount vouchers are given out, the umbrella ladies sell ITNs and make a small profit.
Personally, it has helped me to generate income for my education. I'm a student, yes, and at the same time, I've been educating people about the use of the net. So whenever they buy it, whenever they see me in town, oh, thank you, because of you now we are not having malaria. And then, in fact, I feel happy.
Whether an umbrella lady or a larger African business partner, this targeted voucher program means almost all the donor funds go into the subsidy rather than the management of the program. If a voucher is not used, it's just a piece of paper, not an unused ITN.
So our CINE NetMark is a step ahead of most of our programs. And in terms of sustainability, NetMark is far ahead of all of them, I would say, all of them put together.
In Senegal, the targeted voucher program works hand in hand with the country's unique community-based healthcare infrastructure called health committees, which operate in the most remote areas of the country. Mrs. Fatoumata Ka purchased an ITN at her local health committee clinic with a voucher that covered 60% of the total cost. She and her young child are now safe from malaria infection, and donor funding has been precisely targeted to help those most at need. The voucher program has had a dramatic effect on malaria infection rates in this area and all across Senegal.
This year we haven't had one single death, not one case of death of a child. So really, the program is very important for the population, and it's a program that must continue.